So I will talk about the basics of health promotion and healthcare design, which is mostly based on my PhD, which I finished some 5 years ago, and then some of the research that I've been doing since, and some of the cases that I've been seeing around. So we'll talk about examples of health promotion in healthcare built environments, and we will talk about hospitals and healthcare, and much often these are exchangeable. As Anita has already mentioned, the first episodes were about health promotion and healthcare in the built environment. Here's also a link to the YouTube. And the second episodes, we already discussed the healthcare building design and evidence-based design. So please feel welcome, if you haven't watched those yet, to pause if you're not watching live, to watch these videos on our YouTube channel. So as I mentioned, this is largely based on my PhD research. And in my PhD, it was clear that the word health promotion or promoting health is increasingly used by architects to brand their buildings. So our new hospital is health promoting. And I was very curious what health promotion actually means and why it was different than, for instance, healing or healthy architecture. So I did this literature review to understand what health promotion means for healthcare architects or in relation to healthcare architecture research. And it showed that there's many different interpretations actually to what health promotion means. Often it's used without any clear definition, and it's not referring to existing health promotion frameworks that we know of from public health, for instance. And when it's being mentioned, it's often relating to either healthy behavior or health equity or accessibility or salutogenics, but seldom combined. So it's very focused on either or and never in a combination thereof. And at the same time, I've been relying on, in my research, on the definitions of health promotion as proposed by Green, which is more common in public health research, which means that health promotion is holistic, has a social cultural component. So for instance, we understand that it's very difficult to change your lifestyle, for instance, if your social cultural, your network has different approaches. It's more focused on resources rather than illness. And so it has a salutogenic perspective. It has an equity and justice component. And to be able to do all of that, of course, you need collaboration beyond the healthcare sector, and you need participation of the people that are concerned, so the vulnerable groups. And so these criteria, they are not necessarily recognized in like health promotive buildings as I've seen them. So sometimes they do mention holistic, so person-centered design, or health equity and justice, so more this inclusive design, but seldom combined. So in my PhD, I also tried to figure out if I could revise my definition of what health promotion is. So health promotion, according to the WHO, is the process of enabling people to increase control over, improve their health. And it moves beyond the focus of individual behaviors towards a wide range of social environmental interventions. And I think that already considers many of these criteria that were mentioned before, but the way it's written here, it's much more related maybe to the words that are being used in the healthcare context. So in my own definition, which is obviously very building upon that, I define health promotion as the process of enabling vulnerable individuals, so more paying attention to this equity component, individuals and populations to increase control over factors that positively, and I added the positive because that sort of underlines the salutogenic component, not just focusing on illness prevention, but more on the positive components, and including their living environment, so where people stay. The WHO identified several main settings that should incorporate health promotion, including home, hospital, school, community, workplace. And of course, there's also the hospitals that can also be a workplace and also are a school. So some of these settings also come together. The Handbook of Settings-Based Health Promotion, it's a relatively new book that also indicates per different setting what health promotion could mean. So some of these things are general, but also more specific for the workplace or the healthcare environment. So when we focus on health promotion in hospitals or in healthcare services, there's sort of a distinction that we could make based upon Hancock. He basically argued that traditionally the healthcare would focus on treatment of disease. And actually, if we look around, still many hospitals or healthcare environments have this as their core of their business, and sometimes not much more than that. We are already going to the transition to more healthy healthcare, where it's not just about treatment of disease, but it's about medical care of patients. So it's a more person-centered focus. And it's also about the protection of health of all users. So it's not just patients, but it's also staff, visitors. And that obviously also includes the protection of the planet. And I say obvious because there's strong research showing the relation between environmental health, so the health of the planet, and the health of its inhabitants. But still, this healthy healthcare is very much focused on prevention, pathogenic focus, so looking at the causes of illness and looking at risk groups. Whereas now, what we're trying to do in the International Network of Health Promoting Hospitals and Healthcare Services, and also within our task force, is to move towards this health promoting healthcare, where the health of all building users, but also the local community and the planet is considered. And it has a salutogenic perspective, so focuses on what goes well and how you can enhance on that. And a focus on marginalized populations, which is not necessarily the same as risk groups, although there is overlap, of course. So what then is healthcare building design? And I think that for me, healthcare building design is that you create healthcare environments for health promotion, and thereby you foster positive health, quality of life, healthy behaviors such as sleep, movement, social interaction, but also fostering equity and participation for all kinds of users, and with a particular focus on marginalized communities. We already know from the previous webinars that the built environment influences our health, right? There is different types of design features, so architectural, so how the layout of the building works, or what kind of furniture is used, that affects health outcomes of different types of populations on different healthcare settings. This type of research is building, although in this research, it's often still about healthcare outcomes that, for instance, here you don't see equity, or with the populations, you don't see the local environment or the local inhabitants. So the question, of course, arises like, what is health promotion specific? And based upon my PhD research, I have developed a model to sort of understand the different components to that. So first of all, the circles, they kind of represent, like, is the focus of the healthcare organization and the building design, is it focused just on patients, like the darkest circle, or is it looking to the range of building users, so staff and visitors as well? Is it looking maybe at the community, so the environment, the people that live around, or is it also looking at the planet or the environment? And then the circles, they have different pieces of the pie, you could say, and one side represents a more pathogenic focus. So for instance, how can the building support cure, rehabilitation, disease prevention, or health protection? Whereas the other side of the circle, which is more the salutogenic and I would say health promotive side of things, is what is focusing on well-being, healthy behavior, health equity, and for empowerment. I don't think it's the purpose that we do all of this, but I do think this model can help organizations, but also healthcare designers, to see like what kind of aspects or what kind of dimensions of health promotion am I currently considering? And if that's maybe only on the pathogenic side, then maybe that's not actually health promotion. I'm not saying that that's not important. I'm just saying we need to expand our view in that sense. After my PhD, I've also sort of mapped all different kind of existing design approaches to this dimension. So for instance, there's terms such as healing design, restorative design, supportive design, which very much fits on this cure rehabilitation component. So where there's stress reduction, etc. Or there's safe design, which is very much focused on avoiding people falling, or adding handrails, but also avoid spread of this infection, etc. And on the other side, you also have a whole range of design approaches, which there's a lot more, because that's what I've been focusing on. So that's why you see them. And I will try to explain some of them and also try to show the differences between them. But if you're interested, of course, you can look up these terms and go and deep dive yourself as well. This is an example where the design supports the quality of life and well-being by North Architects. It's a Center for Cancer and Health, and it's already indicating the focus on health in its name. Its placement is in the middle of the city. So this is Copenhagen, and you see here, you see the campus, this area, the hospital campus, and here is the building in the middle of the neighborhood, kind of. It's small scale and next to a major hospital. There's no treatment in this building. Instead, there's a focus on well-being of people with cancer, but not calling them patients and their relatives, but also for staff to relax and retreat. And this building, it doesn't have a reception, but it has a kitchen and a long dinner table. No waiting rooms, but a living room with space for book clubs and a place where people can feel safe to take off their wig, for instance, if they've lost their hair due to cancer treatment. It's often a place where they can meet people in the same situation without being pressured in the waiting room, waiting for cure, but in a more relaxed environment. There's also a book club, ping pong tables, a big kitchen where people learn how to eat healthier to support their other treatments. And there's a gym for rehabilitation, which you can enter also directly from outside. And then the gym is here. So it goes into the neighborhood. There's also, of course, a lot of daylight, natural materials, and different corners with different levels of privacy. So if you want to be alone, or you want to have you're very emotional and you want to not be seen, then that's possible as well. Then there's another example of this outdoor care retreat by Snøhetta Architects. So it's also focused on design for well-being, but you could also relate it to inclusive design or biophilic design. It's a very small pavilion in a small section of nature next to the hospital. And children who are in the hospital for a bit longer, they can go there and leave the ward to meet with family or friends or have their birthday party. But they can also go there to have therapy, for instance, or just talk with the therapist. And they can walk there if they can, but also it's accessible by bed. So you can see this wide, flat area, and there's a handrail as well for people who can walk but have a little bit of extra aid. And you can see that they're completely surrounded by nature. And it's also on the next image, you can see that it's on the inside. So it's very unmedical in a way, a lot of wood, natural materials, but also the cushions you can take off. So it becomes very playful. And you see also that the kids start to move more. And I mean, we can, based on our intuition, we can understand that this is probably a good environment to be in, but it's also supported by research of Elke, who has been working with this, and her colleagues, and they interviewed the kids, and they said that they felt less restricted, more relaxed, and freer to express their emotions when they would go here. So this is especially relevant for kids who stay in healthcare longer. I just want to also say a little bit about the terms universal and inclusive design. The terms and the interpretations differ regionally. For instance, some may talk about universal design and others, they talk about inclusive design, and they're talking about the same thing, but sometimes there are also very strong differences. So universal design aims to design for as many people as possible. Inclusive design focuses on making design inclusive, particularly for people who may have uncommon needs. And some critique universal design, and it's because they say it's mostly designed for the average person, which is almost no one. Yet others argue the opposite, and they said, no, good universal design is designing for the 99%, for as many people as possible. So when you are reading about universal and inclusive design, try to understand how they understand it so that you can interpret it in that way. Because a similar discussion is surrounding inclusive design. Some argue that it's too focused on vulnerable populations, such as, for instance, people with visual disabilities, and it doesn't cater for a whole population. Yet other argues that if you design for vulnerable populations, such as, for instance, older adults, this will also help others, such as, for instance, parents with a stroller or mobility difficulties, or people that have also visual diversities. Well, either way, the thing is that when you design, you should consider that how you design can hinder certain populations, or when it's done well, you can stimulate people to be independent in using an environment which they would normally not feel safe about. And this image, of course, shows an example of, yeah, it's a health promotive in a way, like it stimulates people to take the stairs even though they want to go to the elevator. Obviously, this is not accessible for many people who need to use the elevator. This is another example where it goes well. So this is in Rotterdam, where you can see that the roof garden that they have created on the hospital allows also for people in beds to go there and rest and meet with family and friends outside of the wards. In the same hospital, you can also see how daylight corridors and mixed with waiting areas and a lot of plants create privacy, but also create like views on nature, and create working spaces for some people who are waiting, or just time to catch up for others. And in the same building, you also see this staircase in the back, which is very visible. So stimulating stair use and movement, which is good, healthy behavior. While the elevators are obviously close by, I think you can even see the doors to the elevators, not to stigmatize people who can't take the stairs. This is a good example of where inclusive design and active design can come together. So with inclusive design, again, it's focused on including as many people as possible to use the design. And here you see the stairs, they are not as steep as normal. And then you can also see there's a double railings who has a strong contrast with the back material. So it's easy to see, but it's also double height. So you can choose what fits you best. And you can see that it goes around the corner. And especially these corners are important because that's where actually most of the accidents happen. And what you see if architects are not aware of this is often that where the stairs stop, that's also where the handrails stop. What you can also see here is that this is dark, whereas this is light. So this contrast makes it much easier to see where to step. And then here you can see some lines on the floor also to make it more understandable for people who have, for instance, visual aids. And then, of course, there's the elevator right on the side here. So this is an example of St. Olaf Hospital in Norway. I just want to highlight again that sometimes we think, okay, but this is not so, it's not so difficult. And of course, in the regulations, it also needs to be accessible for people in the wheelchair. And I think that when we're talking about accessibility, it's often about being accessible for people in wheelchairs or strollers or that kind of mobility aids, but we don't really consider other types of diversities, for instance, visual difficulties, or maybe not being able to read, or not being able to, feeling comfortable in a certain environment because it doesn't align with your cultural needs. And this is an example of an architect that they wanted to have one entrance area, and they made like a slope, but at the same time through the normal pathway. And actually this makes up for a very unsafe environment because the people who don't take the slope, they misstep, and a lot of accidents happen here. This is one example from Belgium, but many of these types of examples are there. So even though these are great intentions, it's still resulting in unsafe situations because people with diverse needs, they have not been included in the design. I just want to show another example of Children's Hospital where nature-inspired art is used for positive distraction. It's playful, kids can touch it. but at the same time, it's not childish. So it's fitting for kids of different ages and not just like the smaller ones. And here there's a play area in a hospital as well. So the kids can even play doctor and like reimagine what it's like. And we've already done an older presentation about healthcare building design for children and adolescents. So for those who are interested, you can check out the link. It was hosted by the Red Noses. This is an example from outside of Europe, and I'm still looking for more examples. So please send these examples to us. I think this is Kere Architects, and they are an excellent firm who is doing incredible work with these type of community healthcare centers or this surgical clinic in Leo. And what is important and what they are very good in is that there's much more attention to this holistic social cultural components and the importance of family and community in these healthcare buildings. So that's something that we can definitely learn from because their focus, our focus in at least in Europe has often been much more focused on resources and efficiency, which is, yeah, which we are trying to change now. The last example that I wanted to show is the example of Angered Närsjukhus. So Angered is a neighborhood in Gothenburg in Sweden, and Närsjukhus means nearby hospital or community hospital. It's a combination of that. And this hospital, it's in the middle of the neighborhood in Gothenburg with the lowest life expectancy. And it combines primary and secondary care. So that means that if people there don't feel well and they're confused to where to go, that they can go to one reception. I'll show an image of the reception later. And then the organization will help them guide towards the right health place instead of being sent around. This building is positioned close to a shopping center, and you can already, like where the photo is taken is a transport hub with trams and buses. And one of the important things there in that neighborhood, especially because the people had very low trust in healthcare and very low trust in government in general. They had very different types of cultural backgrounds and often not being able to speak the language very well. They initiated participation with the inhabitants or important spokespeople, and it became very clear that the people who lived there, they didn't want to have a hospital that looked like something that they were used to from home, but they wanted something that was very Swedish, because they argued that actually what combined or what brought all of these people together is that they now all lived in Sweden. So they wanted a hospital with wood, white, stone, and you'll see some images from the inside of the building later as well. And besides that, they also introduced a design competition for the house style of the hospital. So this pattern, which you see here on the roof of the entrance, but here on the side of the balconies and here in the back of the reception that I was talking about earlier, that pattern was also part of a design competition that designers, but also kids or actually anyone in the neighborhood could participate in. And in the jury, there was also spokespeople from the neighborhood as well as from the hospital to make a decision. And in the end, they chose a pattern which represents sort of the enormous housing blocks that are around, but also the nature and the river that is sort of in between the blocks. So it's also a very local design in the end. Yeah, I think for all of these topics, we can go on in other webinars to go deeper, for instance, into inclusive design or active design. But here I try to give you an overview of the different perspectives. And I think it's important to still work with like the current barriers to health promotion. And that's what we're also working on in the task force, of course. So there's a lack of overarching research that combines these multiple dimensions. It's often focused on either inclusive design or salutogenic design, or well, one of these many dimensions. There's a lack of clear definitions and implications of what it can mean. So I would definitely argue for people who are working in this domain. When you use these concepts, it's completely fine to have your own definition, but be clear about what you mean and what you think this will mean for the building. And what is important is that if we're talking actually about building design for health promotion and health promotive healthcare and not like the healthy environments, and we want it to be reactive and positive, then we need to make sure that we use the right terms for that. But I know this is difficult, but I'll try to. Further resources, you can click on these links, but you can also, of course, if you really have the time, read my PhD thesis, but there's also some articles. But most of all, I would argue that go visit our YouTube, our LinkedIn, and our websites. We're so much focused on making all of this information and this knowledge accessible for people who are involved with that. So I want to end with that. And most of all, I want to thank you for joining. And if you want to be involved in any way, if you have good examples, or if you want your examples to be shown in our projects, or you want to show it yourself, please let us know. And that was what I wanted to say. Thank you.